Welcome to IMCAS TV, 10 Minutes with Dr. Goldberg and Dr. Posner. Our topic for the next 10 minutes is energy-based devices and cellulite. Dr. Goldberg, you're a dermatologist and were elected president of the American Society for Lasers in Medicine and Surgery and recently elected to the board of directors of the American Academy of Dermatology, and you serve as co-vice president of the Skin Cancer Foundation. You're also an author. Light Years Younger and Secrets of Great Skin, as well as numerous textbooks. And Dr. Posner, also a plastic surgeon from Florida. Energy-based devices and cellulite. 90% of adult women are affected by cellulite, so I'm assuming both of you are very, very busy. There are a lot of weapons to choose from in this war on cellulite, and a very hot topic today. Can you tell us a little bit, Dr. Goldberg, what are the main devices used? Which are the most effective among the commonly used laser, light-based, high-frequency, radio frequency, ultrasound? We have a lot to choose from.
A lot to choose from. First of all, the fascinating point is that you said 90% of women have cellulite. The reality is the other 10% think they have cellulite.
Right.
So this is obviously a huge audience. And it's not a disease. This is a problem of human skin exposed to estrogen and the resultant pockets of fat break down some of the septi, which create the classic dimpling that we see in cellulite. It is very common. It tends to run in families. It gets worse as time goes on, and the more weight one gets, the worse it gets. And so to think that we're ever going to cure this problem, we can't.
No, it doesn't naturally go away.
It just doesn't go away. And unfortunately, it's not helped by exercise. It's not helped by dieting. Which is where many of these non-invasive technologies have come in. Not to cure the problem, because it's really not a problem, but to simply make the skin look better, and they make the skin look better by tightening the skin. And the most commonly used devices are radio frequency devices, of which there are many on the market. They work through a whole variety of different mechanisms. They're known as monopolar devices, or unipolar devices, or bipolar devices. In some ways, that doesn't matter. They are heat-producing devices.
They're all heat-producing.
They're all heat-producing devices.
That's the common denominator.
That's the common denominator. And what they tend to do is they tend to create a little bit of fibrosis in the second layer of skin in the dermis, which creates tightening of the skin.
Right.
So the general rule is a series of treatments is required, anywhere from 2 to 7, depending on the individual. And with time, there's progressive tightening of that skin.
And are there any techniques you feel, Dr. Posner, are less risky or more risky than others?
Well, you know, in our offices, and we actually have a wonderful multi-specialty clinic in South Florida, you know, we offer many different technologies for cellulite. So most of the patients coming in are offered either a one-shot treatment, which is an invasive therapy called cellulase, which
we talked about earlier today, yes.
It's a device by Cynosure. It's an internal device that is a one-shot treatment that cures your cellulite. Or if patients don't have that downtime or don't wish to have an invasive procedure, we use one of the radiofrequency devices.
And how do you control the heat? How do you know, is it depending on the skin, depending on the patient, depending on...
We measure temperature. I mean, that's what's different about the newer devices as opposed to the older devices. We actually measure the temperature of the skin.
Right.
You want to elaborate on that, Dr. Goldberg?
Yeah, I mean, what you're trying to do really is to get the area that you're treating, you're trying to get to about 60 degrees centigrade. And at that temperature, what you end up doing is you contract some of the collagen fibers, and in addition, you actually create a wound. And the response to that is new collagen fibers. They're shorter, that leads to tighter skin.
So the collagen regenerates.
And much like we do on other things,
scar
such as
tissue, right.
Exactly. So you're regenerating collagen and creating tighter skin.
And what makes some devices work better on some patients and others on other patients?
Well, some of that has to do with the depth of penetration. Each of the devices penetrates to a different depth. And some of that has to do with the technique. They are technique dependent. And finally, you know, it's choosing the right patient. If you choose someone who's thin and has cellulite, they're going to do well. If you choose someone who's fat and has cellulite, you're not getting rid of the fat with these devices.
No.
These are not meant to do that.
And also there are differences in the patient's response. I mean, you'll take two patients who look pretty similar, and one will have a more robust response than another patient.
And why is that?
We don't know. We just don't know. Do you know?
No, I don't know that either.
Next year,
Next
we'll
year,
figure that
absolutely.
out.
That's
And
something
are
to
there
look forward to.
longer lasting effects with the improvements and the innovations that have been made on these new devices?
The results, and again, we're focusing on the non-invasive radio frequency
Non-invasive, right.
devices. You know, the results generally are going to last 6 months to a year, and then people do have to come in for touch-ups because, again, this whole concept of cellulite is not a disease.
As opposed to the cellulase device or their similar devices that are a one-shot treatment.
One-shot treatment.
And probably longer lasting
Right.
results.
And
I mean,
longer
the
lasting.
data is about out to 3 years right now with the cellulase device, and it looks like what holds it 1 year continues for 3 years.
It is 3 years.
So far.
Is your window for the moment.
Well, we don't just have we just
don't
don't have
know
longer
yet.
follow-up.
Yeah, yeah.
But we really think that it's a permanent change.
And
Doesn't mean you're not going to age or change, but it looks like the area treated that's your response.
And what about risks with these new devices? Are they decreasing with the improvements and innovations, or because they're going deeper, is it riskier?
Well, and just start with the temperature monitoring again, and then you can comment on this. I mean, with temperature monitoring, it's safer than without temperature monitoring.
Right.
Okay, we're not going to burn the patients as frequently as we might have in the past.
Yeah, and I think they're radio frequency devices, although they're newer, they're better, they're safer, they're easier, the incidence of complications from them historically has been very low when used for this indication.
And I want to go back to cellulite. Have we begun to understand the cause of cellulite? Is that the missing part of the puzzle in order to continue to improve and innovate these devices?
Well, I think we understand what cellulite is. You know, we understand the anatomical changes. If you look at the skin fat content of male skin, it's very different than female skin. We know that estrogen has an impact on that. In fact, if you take a newborn baby girl and you pinch her butt, she has cellulite, because she has her mother's estrogen. And then that totally disappears. And then when she becomes an adolescent, she gets cellulite back again. So we know the effect of estrogen. We know the anatomical changes. How does one stop that? Probably can't.
And how are these devices adapting to that?
Well, and obviously they're not adapting to the hormonal part
No.
at all. What they're adapting to are the structural changes and improving the structural changes.
As Dr. Goldberg said, you know, cellulite is a multifactorial problem. So one device, one treatment is probably not going to do it.
To change, right.
And we're getting better. Things are getting better. And, you know, the whole history of the devices for plastic surgery and dermatology is usually one of gradual improvement, new technology, and then gradual improvement again.
And what does the future hold for energy-based devices? We were speaking earlier that there will be a lot more home device use. What do you think? Is that a good idea?
Well, I think before we can get to that, we actually are currently doing a study right now that will be presented at the American Laser Society meeting this spring, which takes a totally different approach. And that's
Which is?
Not to look at lasers, not to look at radio frequency devices, but to look at focused ultrasound. You know, we have focused ultrasound that's certainly been used successfully on the face. There are some technologies that are used on the body as well. But this study we did with the Althera device, which is a focused ultrasound device, and we've developed what has now been coined the butt lift. Interesting enough, we treated some 20 subjects in the study, and we only did one cheek and not the other. And at 6 months, you see this tremendous disparity,
a huge difference, yeah.
which of course creates a new problem because then we have to try
Then
to
you
even
have to,
things
right.
out. So they're going to be newer and different devices with time that also tighten the skin. You know, which one's going to be the best? Will we use more than one? Not clear. And then any home-based device may have some impact. But, you know, the general rule with home-based devices is the energy put out by them is so much less than anything we do in the office.
So less effective.
Less effective. So for cellulite, which is so difficult to treat even in the office, a home-based device probably is icing on the cake.
Thank you so much. Thank you for joining us.
You're very welcome.
See you next year at IMCAS TV. Thank you.